Welcome everyone to the second episode of the AI Oncology Revolution. I'm Dr. Arturo Loaiza-Bonilla, and I'm here today with Marissa Marti-Smith, an oncology nurse practitioner specializing in breast medical oncology at Texas Oncology, a place that is really innovating because it's a combination of it's big practice and it has lots of folks interested in AI technology implementation, and we're kind of writing from many years the innovation in terms of how to optimize workflows for patients. So welcome to the show. Will you be able to tell us more about yourself?
Well, thanks so much for having me. This is amazing as an educational outlet, for everyone to learn about AI and how we're using it in healthcare. So I've been a nurse, or I've worked in oncology for about 17 years. I've worked for Texas Oncology for 14 as a nurse, both in clinic and infusion. The last 7 years, I've been a nurse practitioner. So I've been in many areas in oncology. And so I've really enjoyed just how much oncology has changed even since then. So it's pretty amazing to be where we are today. So
Wonderful. And thank you once again for the time here. So today's focus is going to be, how alive in the day of the use of AI from, an oncology practice from a nurse practitioner perspective, which is not a common thing. We always, see how we can use it for like tools and optimization and never with the heart of a practice. I wouldn't live without my nurse practitioner. So they really make lives easier, better, and talk to solve a lot of fires for us. That means that there is a chance that they may be using some AI tools to also make their lives better. So can you tell me more about things that you're using right now in terms of AI? What are the things you've been hearing in the space? Just open whatever you want to tell me about it.
it'll be 2 years, I think, in August of this year that we've been using an ambient AI DeepScribe, where we literally walk into the room, we, hit record either on our phone or an iPad, and it records our entire visit. It's pretty amazing because when we first started using it, you have customization. So every provider is so different in what we need in a note, whether that be interval history, ICD-10 coding, impression plan. I mean, all the things, updating social history. So you can toggle off the areas that you don't need updated if it's just a follow-up. You can toggle on everything if it's a whole new patient visit. So it's pretty amazing. I thought back to when I first started in practice, which wasn't that long ago. I mean, I'd be in rooms just writing notes, trying to type part of my note, and then I'd go back and dictate in my office. It would take forever. And, many of us would spend the end of our day doing all this dictation, when we're exhausted and just ready to be at home. So it's pretty amazing that Texas Oncology, which I read we have over like 1,000 clinicians, 240 plus sites, that our executive team just took this under our wing and did a pilot program with some clinicians and saw how wonderful it was and allowed all of us to take this under our wing as an opportunity if we wanted to use it. Now I see, I mean, even some clinicians are just now getting into it, but I was an early adopter because, I mean, you can just sit with the patient, be present, you're not distracted. I used to scribble notes if they've had surgeries or, things that I'm like, I can't forget that I have to write this down. And so there's so much freedom in caring for patients with this program. It's just pretty amazing. And it picks up things that I'm like, wow, if I was dictating, I probably would have forgotten to add that in there. I mean, small things, but just it's been so practice changing. It's really amazing.
And something that I'm always curious is exactly to learn, if actually, nurse practitioners were interested in using the tools because they're so personable always. So sometimes we're running as physicians in and out and just talk to our APPs. Kate, can you please help me with this? I had to move on to the next patient. And I also feel that having some form of e-scribe for them to be much more efficient and really spend the time with education and solving problems and understanding the context of the patient's issues is going to be really, really impactful. So in terms of, your practice and beyond, of course, I have my own opinion at my own practice. Some people use those AI tools, some others a little bit less. So I'm always kind of asking folks, hey, if you had this pajama time where you spend so much time over the weekends or after hours looking for, finish your notes. So first of all, I tell, the notes are at the end of the day mostly for documentation. It doesn't have to
Hmm.
be, super long. And second is for billing purposes. We aim for if I'm going on vacation, then you can read it out. So
Hmm.
how can, Medong's nurses and nurse practitioners as a whole work together to really successfully implement AI into practice so we can really be, take advantage of the most of its tools? And what have you seen in the space?
So, I mean, I looked up just out of curiosity, like how much Texas Oncology did kind of a data, they looked at data and they said that 1.5 to 2 hours of saved time for clinicians per week just on documentation. For chart closure, it was 1.6 minutes for a provider to close a chart. And then it took for the upload from the note to the EHR like 2.4 minutes. So like after the visit, you just hit stop and within a few minutes it's already in your chart. So I mean, just the amount of time from me being able to chart as I go through the days, amazing and very impactful. But also I think in the last month or so, our nurses have even started using AI when patients call in where it can prompt them if they call with, say, a headache. It will give them things to recommend, or they can kind of click and just say, here's what I discussed in terms of management. So it's cutting down on, time charting clerical things that we all do every day that we feel like we do on repeat. And it's just going into each of the areas, helping us all be more efficient as we work, with our patients and ultimately giving us more time to be face to face with patients.
And I've seen a significant improvement, particularly in people just closing the notes and stuff. So I think it's super important. So like moving beyond scribes, because it's the most like widely used, right? Everyone says using AI is because they're using, mostly these scribes and whatnot, and some integrated into electronic medical records. So, Epic, Cerner, Flatiron, and others are using, their own EMRs to optimize things. And I just had for example, this morning, I was just talking earlier because we're going to deploy some optimization to help us to, do prescriptions faster just by listening and kind of putting the orders, which I think is
Wow.
very mind blowing to me. I love it, of course, makes my life easier so I don't have to be telling people. Or I don't forget. Actually, remember there was a patient that I saw yesterday, and I had finished my notes and was like, oh my God, I didn't renew the EMLA cream, which is, it's not really like a therapeutic thing, but it's so helpful for the patient, right? You know that you're getting
Hmm.
poor accesses. And I'm like, and my nurse was gone. So I was like, I wish I had an AI tool that's basically, as soon as we talk about the EMLA cream, we just simply send it out.
It sends
So
it. Yeah.
so I'm excited to see that in deployment. Being at the frontier of practice, I'm always curious because I never get a chance to go to a lot of oncology nursing conferences, and I know you have your own, and you have a ton of information exchanges there, and are very focused on your daily practices. So, what are the the avenues of research that you're seeing? I mean, not foundational models, of course, that's different, but like for optimization of workflows in nursing that you have seen in the space. I looked them up myself just to like understand a little bit better and be more informed for today's episode, but I would love to hear from you.
I mean, I know we were talking earlier. I just started using Open Evidence, which is new to me. So I'm learning that platform. I just saw this week in the news, NCCN approved just risk assessment with women age 35 for breast cancer risk using an AI tool. So that's pretty interesting. I think the majority of us are really using it as a scribe, but definitely clinically, if there's a topic that we think of that's like, hey, can you tell me something specific with maybe this therapy and a risk of ILD? What's the treatment plan? Or what would I do if the patient, has renal issues or liver issues? So I think it's really just we're barely going up the iceberg here, seeing all the tools that we have and I know I feel like I'm barely utilizing what I do have, just because we get busy. But I think there's so much more that we have. But I know they're using it, for mammographies, for finding breast masses, also in pathology, reading different pathology types of reports and things like that. So I think every area has its own use for it. And for nurse practitioners, I mean, I don't know any specific necessarily. I mean, other than really we rely heavily on references as we're in practice, and scribes allowing us to be more efficient, really in the day to day.
I had the same, assessment. I even talked to my nurse practitioner. She works closely with, maybe some organizations as well. And my oncology nurse, she's very involved with ONS. So I was like, do you have any guidelines? I mean, interestingly enough, it's not that oncologists have tons of guidelines either. We have some frameworks and statements. But not that I want to, paper us down with more things that we need to look into. But it was interesting to see that. And some studies I started looking just in focus on nursing and oncology alone is mostly, as you mentioned, AI for like risk prediction, which is most of the studies.
Hmm.
Symptom monitoring was another component, decision support to help us to be much more efficient, and then care planning, which you always are very involved with. And all these are shifting super rapidly, right? So there's like one time there
Hmm.
was something coming up and then news, and now we have all these models. You mentioned open evidence. ChatGPT came just a few days ago saying, we have a new model, and Anthropic has another one, and Perplexity Health has another one. So every single LM has now something to show in front of us. And now there's some benchmarking, which is good as well. So we're trying to see which one is have the most accuracy and fidelity and able to tell us things so we can help us. And I think we were talking earlier about, these guidelines. So I looked up something called the nurses framework, which is a very broad, like was published by the Nursing Outlook, and it just basically reflected what we discussed earlier before the conversation today, and is also how important it is for us to keep developing these governance tools, right? So because we
Hmm.
had the EU coming with these gazillion things with full implementation coming this year, which is almost everything's high risk. And then we had the US, which is more like an wild, wild west in terms of like, okay, people deployed this and there. So I'm interested to see what the space is going to bring us.
And I think some patients, are a little leery of it. I mean, when we come in and we say, "Hey, we're using AI," it's just taking notes for me. Is that okay with you? Most of the time, patients are okay. We explain to them that, the AI is not making any decisions for us. This is literally just taking notes for us so that we can easily transfer this visit into your note. So I think it's a lot of education for patients and making sure that they're fully aware of really what we're using it for. Um, at least at this time, so that patients are aware the safety of it. But definitely, having very good guide rails and different HIPAA specific things so that patients are comfortable with us using these tools. And I,
Just saw these news about this Utah model where they have two companies now doing renewals of scripts. So in this case, fully automated by AI. So of course in Europe that will never happen. That will be like immediately like shut down. And so
Mhm.
I'm more like a medium person kind of guy in that sense. So I don't know your feelings about it, but I almost feel that there's always has to be some form of human in the loop doing this. And I trust my nurses 100%. So they do a lot of my life easier. So I want them to use their tools at the maximum ability, but also kind of keeping us all in the same practice so we know what's happening.
Just thinking about sending prescriptions by verbalizing and saying, "Hey, I want you to send this script." Even that makes me a little nervous. But I mean, the scribes are very accurate, I would say mostly, but there is the human error of us saying the wrong thing, or if we're just mumbling and it gets the wrong dosage. But it's interesting because in or in NP school, I was with a provider where we documented everything by hand, and it wasn't that long ago. But she was in a small rural practice. Everything was prescription. I had to write every prescription that I gave patients. So you do learn and you memorize things better. At least I do by writing when I initially am learning. So it's kind of crazy to think if you could really dictate that and it could send itself.
I
You
think we
know,
need to have this kind of like AI off drills where we continue to keep some of that muscle memory coming up so we don't
hmm.
become stagnant because the de-skilling is real, right? So, or the never skilling. So, we don't want anyone just simply going in and just open whichever LLM, ask a question and don't even remember that. I would rather have the exercises like, hey, think about it first. I think this is the dose, this is what it is what I'm going to do. I mean, it takes us a few seconds, milliseconds. It's not really a lot of time that you add on this exercise as you think. And then you use the tool just to like confirm it, right? That'd be
Hmm.
much easier for me to kind of keep us, you know, human and really skill on the thing, because we even know that using tools makes people forget about it or become dependent on it. And that's, I don't want that, right? So for sure, I don't want that for
Right.
any, or for my nurse to be like, "Ah, I don't know this. Let me just check." No, I always trust them because they're the best in looking into these things. So
Hmm. Yeah.
sometimes I do forget that. It's like, oh yeah, I know where the kid is. I know in that. Sometimes my nurse saved my life because they go and find things that I don't even know were in the office. It's like, oh, we put it in here. I was like, yeah, because I trusted them in doing so. So yes. Um,
Yeah.
there's some frameworks that I've been looking up. So the key one that I saw in the implementation of AI tools is this one called the firm standard for evaluation of vendors. So like we just trying to figure out who is coming into like our practices. The firm is like fair. That means that it gives us equity of benefits, so it's really helping everyone. Useful, that it can, simulate net benefits, so it can really reduce our burden of, matching patients to clinical trials or getting patients, full notes completed. Reliable, that it has local validation, so it's contextual to the needs of Texas Oncology or St. Luke's or whichever place we are working in. And then the models have traceability and non-maleficence, that we can actually turn it on and off as needed. Particularly when something goes wrong, we want to make sure that it doesn't, impact anything in our patients. So what do you think about that framework, and what are your thoughts about how we can, make it real in the space?
I think, again, because it's so rapidly evolving, I think we do have to tread lightly. And, I think as providers, clinicians, even on the patient side, I think a lot of us see that we really have to have firm, guide rails or guidelines to keep this safe for both us as clinicians and for them as patients so that, it protects them and also protects us. So I think that this is hugely evolving, and especially as AI continues to grow. But I really hope that we get either good laws at the federal or the state level, or however. I know ASCO has guidelines, like the World Health Organization has some guidelines, but it's all like guidelines. I don't know in a league from a legal standpoint what all is really out there, but for our scribes, like you had said, they're really low risk when you're looking at some of the riskier things with AI use. But I think as we continue growing in that area and looking at risk, with patients at home maybe and using AI so that we can safely monitor them a little bit more at a distance, I think we'll have to continue just really advocating for judicial involvement to keep this safe. But I think it's changing so quickly. That's why it's like I hope that someone's working on this so that we can continue to grow in this area in a safe way.
You promote it together. We just can do it through this channel and beyond. So let's do
Yeah.
that.
Yeah.
All right. So now moving more to like the exciting part of all this, the AI Oncology Revolution. So what are you most excited about looking forward regarding, these AI tools, the platforms, the models, as an oncology nurse yourself?
Just amazing. Like I said, just thinking of how far we've come, even since, we started using it like not even 2 years ago. I mean, there's been multiple updates to make our DeepScribe even more efficient. If patients, I'll tell patients, hey, if you had 20 surgeries since I saw you last and you tell me all of them, it's going to update that before I can even go in and chart. So that's amazing, just the time that it takes when you see more complicated patients. And I always think, you're with a patient for, say, 40 minutes and you're just exhausted coming out because you've just been to battle trying to help them get through things. The last thing I want to do is chart. And
Yeah.
so to have this tool to be able to be like, wow, I can just kind of plug in quick, freshen up my note, and it's done. I can move forward past that patient that I struggled with for 40 minutes. And I'm thankful to be able to do that, but it's hard to get through how much paperwork and how much charting can really weigh you down. So I know it's definitely helped me in terms of cutting back on my burnout and my time spent charting. So I think it's just seeing how much it's changed in a small amount of time and just the positive, perspective of just moving forward in this space that can improve patient care, but also just our patients as we are more present with them. I think it's just been really amazing to see how free I can practice now, where I used to feel very just almost like tied down to my computer, tied down to taking notes because I just wanted to make sure I was being a thorough, providing a thorough clinical documentation. So I really am just amazed at how far we've already come. But I'm very optimistic, just all the things moving forward that we don't even know about that will help improve our patient care.
One thing is important is, I would love to have come back when you go to a conference or several conferences that are focused on oncology and nursing. And if there's anything new, exciting, or a combination of them that you want to share, we'd love to get your feedback on that too and as follow-up. So yes, something that I always welcome you to discuss that. So any final remarks on the use of AI for nurses and for those particularly who have not really used them yet because of time constraints or concerns, or they just simply don't know about those things. And hopefully this channel helps a little bit to make them understanding what it's all about.
Just as a clinician, I mean, change is hard. And I think initially it was harder for me to use the tool because it was a change in mindset. I was still taking notes because I was like, well, what if it doesn't record correctly or if it doesn't, you know, uh, get all the things that I'm discussing. And now that I've become more accustomed to it, I can't imagine not having it in practice. And when we do, say our Wi-Fi goes out or something happens, the system's down, I kind of kick myself. I'm like, you're spoiled every day that you get to use this. So I think it's just remarkable to see it come to fruition. And I think just people, you have to be open to it and you have to kind of push through and just be willing to change, willing to adapt and just see it for yourself. And really that's why I love the customization that we have for our templates because I can pick and choose what I want to be included and not included and it makes my experience easier and everyone has a different preference in how they document. So it's pretty amazing, but it is, change is hard and especially providers that have been doing this for years and years, but when you see it and how it really does cut down on time after you get past that initial adjustment, it's pretty amazing. So just an open mind and an openness to using a new program.
But it's all exciting to see, we're really going into utilizing all these tools to help us. So, looking forward to see the feedback of everyone here. So, but thank you so much for the opportunity to talk to you and understand a little bit
Yeah.
more how, that we're using AI from the oncology practice and from a vision of a nurse practitioner. So thank you for joining us. My name is Dr. Arturo Loaiza-Bonilla. Look forward to seeing everyone soon. And thanks again for being here with us.